tremendously confusing, Barbara. So the updated recommendations from the CDC that were adopted by the Rhode Island Department of Health just prior to New Year's are that if you have a positive test, you need to isolate at home for 5 days. And then for the next 5 days, wear a mask whenever you're out in public to prevent any chance of transmission to others. Now, those recommendations can be adjusted a little bit for healthcare workers in crisis situations. That's obviously not an ideal scenario.
Let's talk about the healthcare situation. If a facility is in crisis mode, you think it's okay if healthcare workers go in if they're asymptomatic?
So if a worker is vaccinated and asymptomatic and masked, and a situation is in crisis mode, meaning they simply don't have staff to take care of patients and patients' health and safety is being put at risk, you're kind of caught between darned if you do and darned if you don't. In those situations, putting a worker back in place with a really high quality N95 mask on is probably better than having patients be sick for lack of care. But that is a worst case scenario. We should be allowing healthcare workers to heal at home, and we should be avoiding exposing patients or the public to people who are infectious whenever possible.
The staffing shortages have led to this, though.
The staffing shortages in Rhode Island healthcare facilities are dire, not just hospitals, but also nursing homes and clinics. And I want to be clear, Barbara, that those staffing shortages are not due to vaccine mandates. Our healthcare systems across the state have retained the vast majority of workers. The staffing shortages are because people are burnt out or because they can make more money by going and working elsewhere.
So do you err on the side of caution? Do you think people should, if they can, isolate for those 10 days? And then there's also another scenario brought up that people should be tested prior to going back to work. And maybe you can explain the two tests that are out there and their purposes.
The science supports that if you are vaccinated and asymptomatic, so no symptoms, no cough, no fever, no sore throat, it is safe for you to be back out and about, particularly with a mask on. For those who are unvaccinated or for those who are symptomatic, I would strongly prefer to have a negative rapid antigen test before you're back out and about to show that you're not infectious to others. That unfortunately is not yet part of the CDC recommendations, although many of us are hoping that they will change their recommendations to advise that in the coming days.
But then you have the problem of access.
So there are huge testing shortages, not just across our state, but across the country right now. And it's important to understand that there are shortages in both types of tests. One type of test is the molecular, things like the PCR, the ones that go generally deeper in your nose and take some time to come back. Those are used for diagnosis and in some systems to screen folks after coming back from travel or the like. The second category of tests are the rapid antigen tests, the things like the Binax Now that you can buy theoretically over the counter at a pharmacy or a grocery store and do in the comfort of your own home. You get results in about 15 minutes. Those tests are good, not at seeing whether you've ever been infected, but rather seeing whether you are infectious or contagious right now. They detect when you have a high level of live virus in your nose and throat. It's that second category of tests that will be important to getting people back to work safely within this shortened isolation period.
About Omicron, I would just there are so many articles out there, but I was reading one saying this could actually maybe get us out of the pandemic because for vaccinated people, it's usually no more than a cold. Do you think that that can happen, or are you concerned that Omicron may be worse or that there are worse variants out there? There's that multi-part question.
Yeah. So let me be super clear that for those of us who are vaccinated, particularly those who are vaccinated and boosted, Omicron is unlikely to cause severe illness. But even quote unquote mild illness can still be debilitating for days on end. For those who are unvaccinated, Omicron can still land you in the hospital. And what we are seeing in other states, as well as other countries, is that the unvaccinated have about 10 to 15 times the risk of hospitalization or death from Omicron as the vaccinated. So even though this is a milder variant, it is still nothing to shake your head at if you are unvaccinated.
Concerned about future variants?
Mhm. So I wish I had a crystal ball and could tell us exactly what was going to happen in the year to come. I think in a best case scenario, Omicron will speed through the population, boost the immunity of those of us who are already vaccinated or who had a prior infection, and allow us to move on to that magical place where COVID is no longer something we have to worry about on a daily basis. But I can't guarantee that. And I think that my job as a public health professional behind the scenes is to prepare us so that should there be another variant or should there be another surge, our state, our country, and our world are better prepared to handle it so that we can stay closer to normal. Already in this surge, we're seeing both the strengths of what we've done over the past 2 years with vaccinations and the weaknesses, because folks' unwillingness to mask in public indoor situations is what is leading to the unmitigated spread of this virus and risks shutting down our schools and our economy again. It's going to be a give and take most likely for a while. I'm going to keep hoping for the best, but also preparing for the worst, because that's my job as an ER doc and public health professional.
Are we still seeing predominantly Delta in this state, or is Omicron starting to take over? Do we know?
So we haven't seen statistics from the last week and a half because of the holidays. In the pre-holiday period, it was still mostly Delta on samples that were tested in this state, but I expect that that will have shifted and that Omicron is likely now the majority of cases.
What's the bottom line message you have to people watching this who are just very confused? Do I mask? Do I not mask? Do I, do 5 days? Do I do 10 days? Is it really safe? And it doesn't help when you have Dr. Fauci come out and saying one thing, maybe we should be tested, and there's a lot of maybes out there.
Oh, it's so let me be clear. It is so confusing right now to figure out what to do. So here's the really easy takeaways. If you're in a public indoor space, wear a mask. If you are not vaccinated, get your vaccines. And if you are eligible for a booster and haven't yet gotten boosted, please get boosted. If you have symptoms, stay home. I know that testing is nearly impossible to get right now. If you have rapid antigen tests, use them. If you can get a PCR, use that. But regardless, please stay home until you have no symptoms, whether that's 5 days or 10 days. Don't be out in public with a cough, a sneeze, a fever. The new CDC recommendations say that if you've had a positive test and your symptoms are getting better, you can then go out in public with a mask 5 days after that positive test. I think that is a fine recommendation, but the most important thing is stay home until you're feeling better.
And they're also saying you can get boosted after 5 months from your last mRNA. That just came out, I believe, yesterday.
So this is another confusing thing. There are new recommendations yesterday that those of us with 12 to 15-year-olds can now get our kids boosted if they're 5 months after their first set of Pfizer vaccines. Those of us that got originally vaccinated with Pfizer can get boosted 5 months after our original series. But those who got Moderna still need to wait 6 months until they're eligible for their booster.
Oh, see, I didn't know that part. Do you think this is something we're going to have annually, or maybe in another 6 months, the vaccines, or do we just not know?
We just don't know what's coming down the pike with COVID in general or with the vaccines. For now, the 2 shots plus the booster is tremendously effective at preventing both symptomatic and, more importantly, severe disease from Omicron. It really is the best protection that we have, especially when layered with those other things like masks in indoor locations. I am watching the news and, like the rest of us, curious what COVID is going to bring us in the year ahead. I hope it brings us less infection, less hospitalization, and more normality to our lives.
And keep muting myself. Anything else you'd like to add?
I actually would love to put in a message about the hospitals and the emergency departments, if that's appropriate. So So even though Omicron is a milder illness, particularly for those of us who are vaccinated and boosted, the hospitals and emergency departments are crowded beyond belief right now. We are there 24/7, 365 if you are having an emergency. But please don't come to us to get tested for COVID. Use one of the state or pharmacy testing sites instead. And please be kind to healthcare workers. We are all doing our best. None of us want the wait times to be what they are. But the reality is that the hospitals are too full right now across the state. I just ask you to give a smile instead of a critique to the healthcare worker taking care of you.